From inside Alabama's legislature, a long-standing call to reform prescription drug care management in our state. We're glad you're here. I'm Mark Bullock. Valerie has the night off. Two bills now in the Senate would clamp down on so-called pharmacy benefit managers, a kind of intermediary between drug companies and local drug stores. Lawmakers say it would help the locally owned pharmacies better compete, but others say it could have a negative impact on consumers. WSFA 12 News anchor Rosanna Smith has the latest on the debate.
Independent pharmacists and pharmacies all across Alabama, they've been closing their doors because I think it's unchecked corporate greed by these pharmacy benefit managers.
This is why Senator Andrew Jones says he sponsored Senate Bill 93. He says this bill would prohibit pharmacy benefit managers from reimbursing pharmacies less than their actual acquisition cost.
This bill will stop that by mandating fair payments. It prohibits that charge from coming to the patient. And the bill also empowers pharmacists to reject any prescription that they lose money on. And it furthermore enables them to have an honest conversation with their patient.
The bottom line of our opposition is cost to consumers and employers.
Robin Stone, executive director of the Alliance of Alabama Healthcare Consumers, says they oppose both SB 93 and SB 99. Stone says they believe these bills would impose, at a minimum, a $10.64 fee on every prescription dispensed in our state.
It's going to have a huge impact on families. The preliminary and the very conservative estimates is that the cost to an individual person is going to be in excess of $900 a month.
Senator Jones says this fee is between the PBM and the pharmacy, so the customer will not see it.
In law, the bill says that they cannot pass that fee on to the patient or the consumer. Again, there are billions of dollars in profit going to these PBMs. I think they can handle that $10 out of their billions of dollars of profit.
Stone says to pretend that these costs will be absorbed by some out-of-state PBM is just not reality.
This is not a solution to rising healthcare costs. Perhaps as disturbing as the cost of it is the fact that both of these pieces of legislation totally ignore the real problem.
Senator Jones says negotiations are ongoing between the pharmacies, the Alabama Pharmacy Cooperative, and also some of the entities in the state that utilize these PBMs. Now, Stone says he would like to see the legislature hit pause on this and wait for President Donald Trump to address this on a national level before moving forward. Mark?
It is a concern that we have been hearing about for several years now, Rosanna. Both of these bills are currently awaiting committee action in the Senate. You can find out more about that and other issues from inside the legislature at WSFA.com/politics.